This is the OverReaction Podcast.
Welcome to the OverReaction Podcast. We do like to overreact. Or I guess in healthcare it would be called overreact. In any other industry, it'd just be normal. So welcome.
Thanks for inviting me. Pleasure to be here, and certainly willing to participate in overreacting.
That's fantastic. Fantastic. So your background is fascinating. Do you mind if we kind of start there? Like how you got into IT, specifically healthcare IT? Why'd you jump across the pond from Cambridge to Seattle Children's? I think it's pretty fascinating.
Yeah, so I've had a very convoluted life journey. So I actually started my working career in used car sales, and then moved to driving forklift trucks and running assembly lines.
That's fantastic.
To driving semi-trucks, to then going to medical school, and then going to the dark side, which is IT. And the history behind that is my dad wanted me to be a physician. I didn't necessarily want to be a physician, but he only gave me two options, be a physician or a dentist. And I thought, I can't imagine my life putting my hands in people's mouths for 20 years. So I picked physician. But prior to that, my dad's own businesses, which was vehicles, manufacturing. It's a requirement culturally to spend your time off and weekends learning the family businesses and putting your hands into every pie. And I think that was a good journey for me, because I actually like to give people things to do that I know I could do myself. So therefore, I'm quite well informed. So growing up, learning how to do those basics and working in different businesses with my dad taught me how to do business, taught me how to negotiate, how to influence at an early age. I then became a physician because that was what was required of me. And then when I became a physician and practiced for a couple of years, I sought the permission to say, could I do other things? And in the hospital that I was working in, they wanted clinical people to train in IT. And this is the early 90s during green screens, and technology wasn't that advanced. And I did get my family's blessing to say, well, now that you've achieved what we asked you to achieve, we don't really care what you do after that. And so I took the training in the hospital because I thought it would get me off some shifts, right? And I thought, well, this is great. I'd rather learn this than this. And then when I was learning it, I realized that there's going to be a time where this stuff has to be more powerful than just simply practicing medicine. And I sort of took a bet on that and sort of eased myself out and into the technology field. And plus, at the time, there was a lot of change in healthcare where practices were being bought up and you ended up working for a big corporation versus working for yourself because it was too unaffordable to work for yourself. So that's like how I ended up on the dark side, and then did some .com stuff before it went .bomb. Ended up going back home to the UK. So I was trained. I came over to Chicago and lived there for about 12 years.
Oh, okay.
But I went back home because my dad had a serious heart attack and somebody needed to run the family business. And of course, I knew how to do that. So I went back to run it. And our manufacturing business, we used to manufacture cooking oil. I sold that to Kraft Food.
Oh.
So after I did that, I was coming back to the States. But my mother said, well, why don't you work for the National Health Service? They could use someone like you. And of course, parents always say good things about their kids. And my view was they probably couldn't use someone like me. And she said, well, why don't you apply for one job and see if you get it? And if you get it, you're going to stay. That's the bet. So we took a bet. So I applied for a job as a CIO at a women's hospital, tried very hard for them not to hire me, and they hired me anyway. So I lost the bet, so I had to stay.
That was in Liverpool, right?
Yeah, it's in Liverpool, yeah. So then I ended up being in the National Health Service for just over 12 years, working in women's and children's care. And it was a great ride. The National Health Service people are very proud of what it achieves, which is, free point of care service. and people work very hard. And I learned a lot of things about how to run organizations at minimal levels of investment and how to think outside the box when you don't have any money. And I would never give that up now, because I think that's really important to have learned that. But whilst I was working in the National Health Service, I got an opportunity to work for Gartner, and they promised that I would get full exposure to different international scenarios of healthcare. And, it was going to be free travel. So I was like, well, there's no downside to that. I can learn about different countries and how they work and work with governments and everything else. And so I did that journey for a while. And whilst working there, I sort of developed into their lead for Epic EMR. And Cambridge came along because they had put in Epic, first one in the UK, and it wasn't fully complete, and they had some outsourcing money challenges, and we were providing them advice. And the chief medical officer there told me in a meeting, he said, well, the advice is really expensive, and I know you've worked in the NHS, and I know you grew up in the UK, because pretty much everybody knew me, and why don't you just come and work for me and help me solve some of these problems? And he told me the upside being Cambridge University is a very well-known, internationally recognized and respected place. And he told me he would make it worth my while. And I thought he was a nice guy. There was a good reporting line. And, usually you work for people, right? Do you think you're going to make a difference? So I took the challenge, and then I worked for him for a few years. And I've been at Seattle Children's now for 7 years, and this came along through a similar model. They were looking for a CIO who had more international experience. They'd had a lot of turnover at leadership level. They wanted some stability. They invited me to Seattle in June for an interview. It was my first time to Seattle. I didn't really know that it was rainy. So it was beautiful in June. And then once again, I clicked very well with the CEO, who I work for now, and you work for people. And so I haven't looked back since. And from a change management perspective, it hasn't been difficult because, hey, the weather's the same as the UK. So I didn't really have to reacclimate myself. And here we are 7 years later in the pediatric space. And I love pediatrics because it's the only job where you never have to think about why you do it, right? Yeah. So you have that focus, and every day you're supporting the care of kids, and who's going to defend kids? Somebody's got to do it.
Yeah. So do you ever get the itch to get behind the wheel of the big rig again?
No, I was a lot younger then. Now I'm a lot older, and my body doesn't move the same. So I even struggle to get in and out of an SUV, So I'm like, oh, and I'm going to climb all the way up there. And back then, the big rigs were, well, we called them lorries in the UK. The big lorries, 20-ton lorries, they were manual transmission. The clutch were heavy, right? You had to have a strong leg.
Yeah, double clutching. It's interesting, your background. My background, I drove big rig. That's how I put myself through school. So I worked in the oil patch in Canada, and then drove gravel truck and front end loaders when I was in university and down here in Utah in the States. And I kept mine active because my grandpa started the company, the trucking company, back in the 30s. And he got old and just said, Jeremy, you can't promise me one thing. This was a couple years before he died. You can't give up your commercial driver's license. Keep it active. I'm like, I don't drive truck. It's been like 2 decades. I don't need to do this. Like, you keep it active. That's a Bickman tradition. I'm like, okay, that's an interesting tradition. So I keep it active. So every 2 years, I have to go get a full physical, submit all my medical card information to the Department of Transportation. Now the Homeland Security, they want it. So every 2 years, in fact, I have it next month. I've got to go back and get it all recertified.
Yeah, I think that's a good idea. I mean, the one thing I learned in this sort of journeys, and I understand what my dad was trying to teach me, is you have to appreciate the people that really do the work, right? That's fundamentally, being a lorry truck driver is not people don't view them, but the reality is they do an amazing service to keep our countries running.
100%.
And it's a very difficult job to be on the road days and days and days away from your family. It's not hugely amazing in terms of pay. It is hard work. Driving constantly is very difficult. So what I learned from all these different jobs my dad made me do was appreciate what the frontline face is. And you can't really appreciate it till you do it. Back then,
Yes.
loading a lorry by hand.
Yep.
Oh my goodness, I would go home on weekends and take lots of Tylenol and cry because I was never an athletic person to start with. So to see what somebody would go through, the truck drivers that worked for my dad, or even the forklift drivers running around all day, running these machines, taking care of these machines, driving up and down, well, in this case, the UK, which isn't as big as the US. So you literally didn't stay out of home for that many days because the whole country was only about 500 miles long.
Mm-hmm.
It's rough for what you get paid. But if they didn't
yeah.
do that, how would we all get what we need? We live in this world where we are 100% reliant on online ordering now, right? I order something, it miraculously appears. But we never appreciate how many people touched that package to make sure I got it in the 2-hour, 24-hour, 48 time. So I've learned a lot about appreciation of different roles. So I would never give that up. But being on the road in a truck is a bit. It can be fun too. It's not that bad. Sometimes.
I like mine because we didn't stay over. Like when you moved a big rig or you're moving huge machinery, it was always day travel. I think I stayed overnight twice. Just never had to do it. But to your point, you were saying earlier, it's interesting. I got a friend of mine just yesterday sent me a meme, and it was about basically saying, "Hey, rural America and rural Europe need to wake up. People in the cities, we're going to come for you." And I went, and I messaged back and I said, interesting. I said, where do you think all the food, energy, water, manufacturing, production that all the cities uses comes from? Like you don't,
exactly.
like I'm just saying, like if the world went to hell, they don't need another software CEO like me. But they're going to need welders, drivers, farmers, people who know how to do power, electricity, water generation. I mean, water processing. Like, pretty soon, the stuff that really matters the most that the truck drivers and the farmers and the electricians do, that makes what I do possible. I can't do. They could probably do without me to some extent. Well, and probably to a large extent. I can't live without them. So maybe we should show, to your point, a little respect.
We saw that though just most recently in the pandemic, right?
It's true.
Who kept the country running but the truck drivers who risked their lives, put their masks on, whatever they did, and they were going from point to point to point to point where everybody else was hiding at home. Certain professions were out there, right? Building professions were out there. They were building homes. They were building buildings. They were building bridges. They were delivering goods. They were doing supply chain. They were bringing us our toilet paper, right? So
good point.
They have kept the country running, and I don't know if at a national level they received the recognition that they should have received from the government. I mean, truth be told, they are the hidden heroes. And even now, we rely on a lot of people. It's the same thing in a hospital, right? I agree with you. I mean, if my role didn't exist, or I left, or they decided they didn't need my services anymore, my health IT function in my hospital would still run. The people on the ground would still do the work that they do well on a day in, day out basis, supporting the patients, supporting the physicians, the nurses, the allied health professionals. They are the people doing the work on a day in, day out basis, 24 hours a day, 7 days a week, 365 days a year, right? That's why in the pandemic, the doctors and nurses kept working.
It's true. That's 100% true. Switching gears a little bit, you're a CIO and you're the chief digital officer. What's the what's the current purpose or function of a CIO, and what actually should it be?
Yeah, so I mean, there's been lots of books, articles, and everything else about how does a CIO,
TED Talks.
some may argue, career is over, transform themselves from a day-to-day operational individual who just does technology to being a true business partner who is a problem solver, who understands what the exam question is, and then goes and solves for that exam question. And so I would say that, yes, there is a component of my job that keeps a close eye on lights on, doors open in terms of operation. But I do have people that manage that, but I do keep a close eye on that because I'm heavily into delighting our customers, which are doctors, nurses, allied health professionals, patients, parents, and especially kids, because what I can tell you is the average 12-year-old kid knows more about IT than I do. And that's very eye-opening because when you sit in a meeting with a kid and they tell you what you've done wrong and you're like, wow, I don't even know how to use all these things that they're talking about. Then the bigger part of the job, I would say that's only the 20% function of the work. The bigger part of the job, the digital piece, is really how are you going to optimize the business that we're in? And the business that we're in is patients, not technology. I always tell my team, we're in the patient business, not the technology business. So I might be like the next technologist who likes the next shiny, bright lights on a box somewhere in a hidden location. But the reality is, I've got to be out there talking to people about what problems do they face and can we help them optimize those issues? And sometimes the answer isn't technology. Sometimes the answer is process. Sometimes the answer is people. And technology may be a component of that or not. But the expectation of a chief digital officer is the ability to navigate and understand all of those principles and then to translate that into, well, these are the things you need to do, not me being in a room and saying, oh, you just need to buy more technology. And that's one of the problems we're seeing now with AI, right? Plus, this wouldn't be a conversation if we didn't mention AI a few times. You wouldn't take me seriously otherwise. So
Wow.
that's how it's being sold.
I would say
right?
It was refreshing, but no, we do need to talk about AI.
Right, but that's how it's being sold, right, Jeremy? And people are overhyping the AI. It's going to save the planet. It's going to do all your work for you. It's going to reduce your FTE. It's going to be amazing. That's the dream we have at night. We all have great dreams at night, but then we wake up and we realize, guess what? All these technologies are not free and they have to be configured and they need professional services. Oops, now a project is multi-million dollars of money that we don't have because healthcare isn't making the margins that it used to, and everything is about cost improvement, cost savings. So it's finding that balance, but people expect the chief digital CIO, whatever your title is at C-level in IT, they expect that individual to be able to navigate those things, right? Not just say, oh, you need to buy more of this, but people need the explanation as to why, for a particular use case, an AI might not be the best solution. It might be more just process automation. It might be a bot. It might be just writing code. It might be doing a workflow redesign. It might be just having a whiteboarding session.
Mm-hmm.
And that's what people expect, the evolution of the CDO, CIO, CDIO. There's so many title combinations, right? So let's say the IT person.
CCHI. There's so many acronyms I can't even remember anymore.
There is, right? But the reality is the job is still the same.
Sure.
It just doesn't, and now people will throw data in there as well. But the reality is we were doing all of that. Because if we weren't doing all of that, Jeremy, then does that mean, 18 months ago when I changed my title, was I the chief analog officer then? Right? Because this digital thing, all this technology has been there for a while. It didn't just show up 18 months ago because some title said chief digital officer.
Yeah,
and maybe we're not even digital officers because digital is hard to define.
Yeah, I was going to say I was on a conference call with one of your peers about 6 weeks ago. I love him, Chuck Podesta, and I was like, Chuck, can you explain to me CIO, Chief Digital Officer, CCHIO, and what's the difference between health IT and digital health? And he's like, Jeremy, I could care less. Like, I don't know. Like, I've lost track. All I know, if it's technology, it fits under me. If someone wants to call something digital health versus that's just normal software, I don't care. If someone wants to bring up AI to me, I'm like, it's just better software. Like, you can try to wow me with everything right now. AI is little a or big A and little I to me. It's big artificial and it's a little intelligent at this point. I'm like, that's a
Yeah,
pretty
I
good
think
way to
that's
say
pretty
it.
wise. That's pretty wise, right? He's not wrong. The reality is the job is the job is the job, and you have to execute the job based on the needs of your business. And if that happens to be some digital, some automation, some artificial, some faking it till you make it, then that's exactly what it is, right?
Yeah, absolutely. So you brought up earlier, I want to get back to the patient a little bit because I do a lot of calls and I just do a lot of reading. I do probably too much posting. And it seems in some capacity, a lot of organizations have forgot why the healthcare industry exists in the first place, which is the patient. It almost like feels like the patient is kind of an also ran in the discussion about too much strategy, and it's almost like the patient exists for healthcare, like healthcare doesn't exist for the patient. Do you see some? I know that's not the case where you are. I've talked to you before, but am I off the mark on that, or am I just misreading the overall healthcare room?
No, so the premise of US healthcare is facilities and margin, right? We want to build bigger hospitals, bigger campuses, wow you with what we have,
Acquire,
and
acquire, acquire.
acquire, be bigger, drive revenue, drive margin, and some of them are for profit, some of them are not for profit. It's still really a business when it shouldn't be, right? The nirvana of healthcare as a citizen in this country has to be this is the greatest place on the planet, and therefore some of your rights should include access to healthcare. And it's our right to assure that if you do go to hospital, you get the best outcome. And to me, the best outcome would be not that they have a digital experience, but that you live through your ordeal. Because isn't that more important than I had a digital experience, but I died? Right? That's not really what you want. So it's we're sort of focusing on the wrong things because prevention is always better than cure. And for me, the dream nirvana for any facility, including pediatrics, is we're in a world where our organization isn't needed because kids are just well.
Mm.
We figured out how to keep them well and out of hospital and therefore don't need a hospital. Whereas what you're seeing is all these big health systems keep building more facilities and then filling them up. That means people are actually sick. We don't want people to be sick, right? I wouldn't wish illness on any person, especially any parent, because
Sure.
that will break your heart, especially if the outcome isn't a positive outcome. So it's sort of skewed, right? Whereas if you look at socialized healthcare systems like the NHS or Canada, France, Germany, Ireland, Australia, they are very heavily focused on the preventative side because they have to fund your care. They actually don't want you to come to hospital because it ends up costing the government money and they don't want to spend that money. So they'd rather keep you healthy outside of the hospital. If we were to shift our thinking and say, hey, even if every big city had free primary care for everyone, less people would end up in the hospital. And for those individuals that are homeless, don't have access, and they get this free access, they would be healthier faster to get back on their feet faster to then be able to maybe get a job and help themselves out of whatever situation they're in. So that's how I look at it. The incentivization is wrong, right?
Yeah. Yeah. It's interesting. I'm from Canada, and my wife's actually up there taking care of a family member who has a chronic disease. And so her experience going to the hospital and the clinics with the chronic disease, she's like, Jeremy, it's horrible up here. But again, on the prevention side, they're probably better. So her experience the last couple of weeks has been, this is so unlike what my friends and she and other family members had to deal down here when it comes to chronic disease, when a treatment actually has to happen. So it's like, how do you strike? And I don't know if there's a perfect balance.
Well, it's a strange system, right? So I understand where she's coming from. The problem you have in socialized care is, yes, they provide a primary care layer. Then if they do refer you into the secondary care sector where you are treated for chronic disease, they're under-resourced, understaffed, overfilled. Then you have the problem of wait lists. Then you have, yes, am I getting the right care? The continuity of care in any health system I've ever worked in is always a challenge.
Yeah.
So you have to explain yourself 12 times over. I mean, I'm also, I have chronic conditions and I consume healthcare, and I'm a physician who has a really bad experience with my own personal healthcare. It's very disjointed, very fragmented. And people always say to me, socialized medicine is terrible because you can't get an appointment and there's a long waiting list. And my experience here in Seattle is the waiting list here is longer than my hometown in the UK. And I'm paying, right? So a lot of times when I go to see my parents, I just get an appointment at home and I get seen at no cost. Versus here, every time I try to get a secondary appointment, so my PCP appointment wait time is at 4 to 5 weeks. I'm usually well by the time I go to my PCP, and their answer is go to the urgent care or the emergency room. Problem is, you go to the emergency room, now triggered a $20,000 cost, which you will have a co-payment that you will have to make.
Yep.
And there'll be a long wait. Still, there's a long wait. I mean, you could pay $25,000 in an emergency room and still wait 5 or 6 hours for your care. The urgent care facilities aren't open around the clock and don't necessarily take on too complex a case. Why? Because the other problem in our health system is everybody's afraid of liability.
That's true.
Then they went to virtual care. You can call someone on a number or a telemedicine call, and they always err on the side of caution. Yes, I think you should go to the emergency room. So how is it not convoluted towards you spending money without necessarily getting the care that you need? And a lot of medications that you take are gate kept for no reason. Like, you look at antibiotics or basic cholesterol medication or basic medication for high blood pressure and things like that. Do you really have to spend $250 on a patient appointment to get a script for a cholesterol lowering drug? Couldn't that just be over the counter?
Yeah, there's so much change that can be done.
Okay.
Like there's and then we could get into the middlemen, like what purpose do PBMs and RBMs serve? Like I don't understand it. I've been in healthcare forever, and people go, "No, Jeremy, here let me explain." I'm like, no, I understand what a PBM and RBM. I understand. What I'm saying is I don't get it. Like it still just doesn't make sense that this has to exist.
Yeah, so it's a bigger problem, it's a bigger systemic problem. That you're right, there's lots of complexity, lobbyists, etc. involved, and from the price of medication to the price of care to the access to care to the outcomes of care. Those are all different debates you could have for hours on end. But fundamentally, you as a patient, me as a patient, I have only one need when I go into a healthcare facility is A, the clinical people listen to what I actually have to say, because I'm the patient, I know my body the best. And B, please, I would like to live. Everything else, yes, it's great to have an app. It's great to have a digital front door. It's great to have all these things. But not so great if you don't survive it.
That's very true. Is there any, I mean, to your point, like tech should be an enabler, not a distraction. So is there, which tech do you see when done right is an enabler of your mission and a hospital's mission? And then what tech do you think actually is more of a distraction? Like it's really not, even if it's done right, it's not really moving the needle too much.
So any technology in a hospital that allows a patient to gain the access that they need when they need it, and also the knowledge that they need when they need it, is where I think the money is, right? Because I, as a patient, want to be able to get an appointment and just book it myself without being in a queue on a phone for
Yeah,
hours on end. I
absolutely.
want to know what my results are when they drop because everything's electronic. I want to know, are my labs high, low? I also want to be having my questions answered as and when I have questions about my care, my health. Those are, so to me, those are the key principles for any person who wants to consume healthcare, right? And technology absolutely can help in all of those areas and is helping, right? So you can access your medical record on your phone, you can have a telehealth visit on your phone, you can see your results if they're released to you in a reasonable period of time. You can see those on your phone. So you can book appointments as and when you want, but it's not universal. And it's not universal from primary to secondary to tertiary care either. So as I've
It's
navigated
true.
health systems myself as a patient, my primary care doctor uses some convoluted EMR, which has a really poor app and a really bad online experience, and they keep updating it, making it worse. Then I know that the information doesn't translate to my secondary care appointment, which is a different organization that uses a more standardized EMR that people are more familiar with. But then they send me to somewhere else or send me back, and then the information doesn't flow. And asking questions along the journey is really difficult. If I want to know something about my care, so I most recently received care and I had some blood tests and I looked at the results and some things were high, and I sent a message through a portal to ask a question, which then went into oblivion, and then got an answer 5 days later that says your doctor is unavailable, make an appointment. And then I tried to make an appointment and they said, well, that'll be a 4 week wait. So now all of a sudden, my experience isn't that great, even though digitally it allowed
Yeah.
me to see, but I never got the conclusion. And truth be told, most patients are not good advocates for their care. It's different for me because I'm a physician and I can argue my case. And I saw my lab results and I understood them because I was trained to understand them. But imagine yourself as a patient who doesn't understand the terminology, is sick, doesn't understand all these things, and is not getting that assistance, that guidance, that education, that help. Does that not translate into poor patient experience? And in many
100%.
cases, more anxiety, more stress, probably you'll feel sicker.
Yeah, it's I kind of liken it to, because your average patient, you're describing your average patient. Your average
Yeah.
healthcare consumer doesn't know, and they're ignorant, and when you're ignorant and you don't know, and it's not your fault, your anxiety level's naturally higher anyway. You don't, and you almost feel like you're bugging the nurse or bugging the doctor asking the questions. It, and so then your anxiety goes up, your ignorance goes up. It's like one of my daughters dealing with this. We have really good mechanics now, but previous mechanic that anytime he interacted with a woman or someone he thought didn't know would just talk down to him, talk over their head, use all
Yeah.
these terms. And if you're not a grease monkey, as they say, you don't, or a wrench head, you don't know. They're like, oh, your Fetzer valve. Okay, there's no such thing as a Fetzer valve in a car, but they could throw
Yeah.
that term, and you're just like, well, what do? I don't want to crash. I don't want my car to blow up. I don't know. And in so many ways, when I talk to people, the way they describe just going to see the doctor, forget even going to the emergency room or surgery or something, they describe it that same way, where they're just, I felt like an idiot. They talk to me like I'm an idiot. I don't know what's going on, so I just kind of do whatever they say. And then sometimes they go, like, people wonder, like, well, patients don't come back in for visits. Well, that's a lot of your problem as a as a physician or your office or whatever.
Yeah.
Did they feel like an idiot? Do they know what's supposed to come next? Like, or did you guys take the time? Well, I don't have the time. Like, okay, well then now we're in a vicious cycle.
Yeah, and that's where I go to the whole component of, well, what is the process, and have you sorted the workflows versus the CDIO has sorted the technology, right? So technology is only one cog in this wheel. It's no different, like you said, than getting your car serviced or fixed. They still don't tell you the truth if they think you don't understand what they're talking about. But they have great digital applications now at the dealership
It's
that
true.
show you a picture of where your car is sitting and how it's moving along. And they even send you a video that says, you're going to need $5,000 worth of work, but you don't really understand
Exactly.
what you need. So health isn't any different, right? You go into the doctor and the doctor says, you have condition X. With the good doctors and nurses, they explain why and they explain the next steps. But that sustainability is still a problem through the journey. If you look at the patient journey, we don't have a one-stop shop for patient journeys. And I'll use the example of cancer care,
Well, that's
right?
true.
So if you go to your primary care doctor and the primary care doctor says, I suspect you might have a form of cancer, and I'm going to refer you to a specialist. Then the drama starts. You get referred to a specialist. It takes weeks to get an appointment. You get the appointment, you show up. That specialist then says, oh, I don't know if you have it or not. I have to do all these tests. Go upstairs, go downstairs. Get your scan, get your blood test. So then you go for your blood test, and they tell you have to come back another day for the blood test. You go for your scan, they tell you have to go for a scan. So by the time you actually get back to the doctor who sent you through this journey, weeks have passed. And for those 5 or 6 weeks, you don't know if you're going to live or die. How crazy is that? Imagine a world.
Which is the worst experience.
It's the worst, but imagine if we were trying to build healthcare as a one-stop shop. Imagine if you went in at 9 a.m. and by the time they spit you out at 4 p.m. on that journey, you knew if you had cancer or not and whether you were going to live or die. So how 100%. Many people would vote for one stop versus what I call a spaghetti mess of trying to get somebody through a system?
If they understood it, 100% would.
Yeah, because it's the same. And if you think that, since we're using examples of cars, at least with the good car shops, it is a sort of a one-stop. So you bring it in, they change your oil, the dealership changes your oil, they send you a video of what's wrong. You can actually now speak to the technician if they can explain it to you in simple English. You have a choice to make. Do I want to do the work or don't I want to do the work? If you authorize the work, they go and tell you to have a coffee and a piece of cake. They then go and do the work. And then, yes, you might have sat there for 4.5 hours, but you leave with your vehicle having been corrected with some form of guarantee, 12 months, 24 months, 12,000 miles, whatever it is, right? And yes, you got some sticker shock when you put out your credit card and you saw how much you had to pay. But at least you have the assurance that you went through that journey and you won't have to come back, at least for those problems, for the next 12 months because they're covered and they've been done. Why isn't healthcare the same, right? Why technology has enabled that? So CT scanners, MRI scanners, ultrasound scanners, all fully online, available, instantaneous information pops up on the screen. Lab tests. You can run a full blood count in minutes in an automated lab, which is what most people have. The only thing
because it's got to go back to the primary care. Right. He doesn't want to be out of the loop. So they're like, no, we got to wait. The radiologist, I remember talking to imaging groups, like we could we could give it to the patient immediately, but no, we've got to send it back to
Yeah.
their family doc, and it could take a couple of days. And so the patient's like, well, what the heck's going on? Well, you got to talk to them.
Right. So, but that's what I'm saying. But whilst you do that, you're creating a level tension, which then
Yes.
translates into a poor patient experience. So it's funny because when you go through that convoluted journey, what do health systems do? They then send you a questionnaire to ask you about your experience. And then they wonder why they get poor patient experience scores.
And it's the worst. The CAPS questionnaires are just the worst.
Right. So, and then we all act surprised that we didn't know this was going to happen when we knew this was going to happen, because even if you weren't a patient, even if you as an individual, me as the CIO, if I stepped through the patient journey for a pathway and I had that experience and I wasn't sick, but I was just experiencing that pathway,
sure,
there would not be a light bulb moment to say, now, no, it's pretty clear to me that this is a really bad experience, right? And building more apps isn't going to solve that. It's still a human business.
Yeah. Do you think, and maybe you're alluding to this, do you think that if an organization doesn't take process improvement, like really overall process and patient flow, et cetera, really seriously, that sometimes newer apps and digital front doors, et cetera, can actually make things worse because it gives you the dysfunction much faster as a patient. Like the doors are almost open. You're like, wow, this is actually worse because I get my information quicker, but there's no resolution. I'm still waiting so much longer.
Yeah, and I think it can make it worse because what technology doesn't factor in is the inequity around it. So we make the assumption that we're the superior health system because we built all these apps to help you get your care, but we never asked you, A, do you even have a smartphone that can consume this? B, can you afford it? C, do you even have an internet connection? We don't ask all these questions. We make assumptions. Now, if you look at Washington State, it's quite interesting. Western Washington is more affluent, well-connected. Eastern Washington is farms. That's where all the apples and grapes and wine is made. They don't have great internet connections in the fields. A lot of the working folks there don't have smartphones that are up to date. They have the free phone that they got with their prepaid plan, which is Android version 5 behind, and can't consume the so-called amazing application you built that was going to inform them. Then they have other issues, which is they don't understand English, and so on and so forth. So even we as technologists evangelize about apps and AI and all these amazing things, but did we ever once take a deep breath and take a look at the patient population we're serving and then go and talk to those patients? That's why I said that the 12-year-old is smarter than me, because I have an advisory group of patients and parents, and talking to a 12-year-old who tells me I don't understand, I now understand what I don't understand because they know more than I do. Best case example I can give you is, one day I decided we're a children's hospital and kids come in and spend a long time with us. And what do they do for entertainment, right? How do we entertain them? How do we provide them things to do to keep them occupied when they're sick, right? Gaming or whatever it is. And I don't know that much about gaming because honestly, I can't play these new games, or I don't have a PS5 or whatever it is. But I put this challenge to my team and said, well, we need to do something around centralized gaming, keep kids occupied. And so we just spent the last few years working with Microsoft and other Hive Studios, Mojang, to build Minecraft. So we're the first hospital in the world to have our own Minecraft server.
Was that last week?
Yeah, that was just last week.
Okay,
right?
I saw that.
And that came out of me thinking we should have something, and then smarter people putting ideas around how do you take the stress off a child who is sick, and how do you provide them a safe environment to do so? So because we have our self-contained hospital that was built by one of our physicians in Minecraft, and kids can play these games in Minecraft, but no external people can come in and threaten them and take advantage of them. It's been amazing to see.
That's
I was talking to
awesome.
parents
Wow.
about this, and they were like, this was a lifesaver for my kid who had a world to retreat to when they just were not feeling talkative or well, but it was a world they were familiar with. And I saw the
That's
kids last
awesome.
week as we did a launch play this thing, and it blew my mind. I mean, their hand-eye coordination is so far superior to mine because I could not even move my hands as fast as they were on the controllers. But you know what I mean? It's technology, but we started from there is a problem we need to solve that I thought we needed to solve, but I didn't know how to solve it. And then we got all these people involved, and we've had good help from the vendor community, the technology community, but they all then appreciated that we were solving a problem that wasn't just to provide gaming, it was actually therapy through gaming, right? Because it's therapeutic. So we have gaming specialists now, and they were explaining to me that it's therapeutic for kids to be able to escape somewhere when they're going through a massive amount of pain and multiple surgeries and things that you wouldn't wish on anyone, right? So that's why I'm saying the job that I'm in isn't to just go and I could have just gone out and bought 100 PS5s, right? But that wouldn't have solved for what we were trying to solve for. That would have been my idea of thinking, oh, that's a cool thing. But in this networked environment, all the kids are in that environment. So they can play amongst themselves. They can fight each other. Even I can go in there as a user from campus and they can fight me. They can shoot me if that's what they want to do, deconstruct me. So that's a different way of looking at something than, oh, Zafar solved a problem because he placed an order for 300 PS5s.
Yeah. Well, that feels like, and I think that's what gets lost so much in healthcare to this day is you built the technology truly around the outcome you're looking to achieve, which is improving it for those kids, improving their experience, whatever that might be. And it feels like, and I go back to EHRs all the time, because coming from class, and then I've lost track of the number of physicians I've talked to, and almost universally, they just don't like using EHRs. And some of them will say, these weren't built for us. Somehow we're using them, but you can tell it was not designed for us. And then it wasn't designed for the patient. And they ask, like, who is this really designed for? Who's the primary beneficiary of EHRs being used? And like most nurses and docs say, it's not really for us. But what you're describing is, and we don't have enough time to get into my conspiracy theory on the modern EHR and how that actually came about in the United States.
Right.
But that issue with Minecraft and the kids, you can tell it was completely done for them, as opposed to there's so much other tech in healthcare. Because I use patient portals. I used Epic's patient portal and Cerner's. I think they all suck. Personally, I'm like, this isn't designed for me. This is a very, very different experience than I have with apps that I want. I'm putting an app on my phone. I get to choose the one that really, really works for me for whatever it might be. The healthcare ones, almost without exception, I just don't like. I'm like, they don't feel like they were designed for a real patient or for a real doctor. It always feels like there was some other motive behind it. It's kind of for you, but there's really another purpose for it.
Well, it's a closed ecosystem, right? So the difference in healthcare software is a lot of it's a closed ecosystem.
It's true.
Tech-savvy patients are now used to an open ecosystem. That's why many bright technology people like the Android versus the Apple platform, because it's more open, they can configure more, they can change more. And
Good
Apple
point.
will say, well, it's because we're more secure. And I see both sides of the argument. But you as a consumer now want to choose what you download and you want to choose the experience you have. And what you're used to outside of healthcare software is the different companies vying to entice you and amaze you into their ecosystem. That's the delta difference. Because when I download the Walmart app,
Yes.
every few days they add features to entice me to stay in their ecosystem, to continue to be a customer, to continue to be excited, because they know that others are also vying for me in that ecosystem. In healthcare software, what you're finding is the ecosystem is closed, and we as a patient are being dictated to. That's why you don't have the experience you want. Whereas in retail, if you don't like the Walmart experience, you might like the Nordstrom experience. You might like the Target experience. They're all vying for you, whereas in healthcare software, they're not vying for you. They're telling you this is how you would consume, and
Wow.
you have to either like it or you don't like it, or you just have to work with it, because what other choice do you have as a patient, right? If I want to go on my app and book an appointment, I only have the one choice that the health system gave me. They didn't ask me, am I colorblind? Didn't ask me any of that. Whereas my other experiences, whether it's, retail, whether it's even my email experience, right? I have choices. I can use the Outlook client. I can use the Apple client. I can actually use open source Thunderbird, other clients. I can use. I can even subscribe to other clients. I can subscribe to Secura clients and still what? Consume the exact same thing, which is an email, right? But I've got a multitude of choices. Even the big players in the email space aren't necessarily telling me how to consume the front end of it, right? They're giving me the back end, but I don't have to look at my Exchange mail on Outlook. I can look at it in the Android app. I can look at it in the Apple app. I can look at it in Thunderbird. I can look at it in so many.
Yeah. Proton mail, whatever you want.
Proton, whatever you want, right? But it's still, and then those companies are vying for me. Pick me because I'm more secure. Pick me because I'm more sexy. Pick me, right?
And they have to work together. Like
they do.
I'm in Outlook and Gmail because I have a Yahoo and I have a Gmail and I've got a Proton Mail, and then I've got my business one at Reaction, and they all work. Like an attachment comes here, video can go there. Yeah, I don't know why I haven't thought of that before, but I mean, you put it. Well, I'm going to be thinking about that for a while.
Yeah, it's all about. It's no different than when you go buy a car, right? Every dealer wants to give you a different experience so that you stay with them and come to them and buy their car. That's why you have the Lexus experience versus the Nissan experience versus the Ford experience, right?
Mm-hmm.
At the end of the day, they're all vehicles that drive from A to B. But what their selling point is, you buy a Lexus because it's more reliable, or you would buy it because the dealer experience is digital. And also more flexible versus, you going to Jiffy Lube, where the experience is pretty much not so great most of the time, right?
Yeah, I had a couple of bad experiences with them. I'll never go back. One time they actually didn't put the oil plug back in. I drove away and there was oil was coming out as I was trying.
Well, yeah, but that's people who go for that experience still go for it from an active choice, right? They know it's it's fast in and out. They don't use the best parts. They are cheap, and the training of those technicians is minimal.
Yep.
And they only pay their technicians whatever, $14, $15 an hour, if that. Whereas you go into a Bentley dealership and it's champagne and caviar all the way, and their technicians are trained for 2 years in very specialized environments. And yes, that oil change isn't $19.95, it's $1,995. And so, but they vied for you to take their experience, right? That's just how life is. But you just don't see that in healthcare. We don't actively compete to guarantee the patient the best experience, not only digitally, but also clinically and non-clinically. Because remember, as a patient, you have many touch points. One is the IT touch point.
Yep.
The other is the clinical touch point. And in the middle, there's the billing touch point, which is horrific as well, by the way. How hard is it to understand your bill and then get your bill and then actually get that bill paid off between you, the healthcare provider, and now the biggest drama, which is your health insurer, who never wants to explain why they denied your bill.
And they don't want to explain it
to use AI to deny it.
Yeah, they don't want to talk. Physicians trying to get prior auth, and they're getting the runaround. Like at every point, there's a runaround.
That's right. So these are all sort of interesting topics that you can delve into that are beyond the digital experience. And we're only one piece of the bigger pie. But the patient wants to consume the whole pie. They don't just want the one piece. They want all of it.
Yeah, that's absolutely true. We'll have to do this again. We're running out of time. But is there anything, this has been absolutely eye-opening for me, and it's super fun as well. Anytime I can talk to another trucker. But is there anything else in at the end of this that we didn't discuss that we should have? Anything else you want to bring up? You're like,
no, I think it's we in health IT have to support the business that we're in, and the answer to everything we do isn't necessarily going to be technology, and we need to evolve and understand that. There's many other facets to a health system that you have to go and experience as a technologist. It's not just, I cannot make decisions in my office about what the org needs without actually going and physically seeing what problem am I trying to solve, and then figure out whether I'm just a piece in solving that problem, which I typically am, or I'm going to take on the bigger piece of solving the whole thing. Sometimes you have to do that too, if it's the right thing for the health system. So that's really where I'm coming from in the sort of role that I believe I'm trying to fill.
So spend a lot more time all over the front lines to really, really understand healthcare inside and out, if you're going to be a really effective CIO.
Yeah, because if you're giving people orders to do things, if you're telling a desktop technician, hey, I don't understand why you can't build a machine and give it to the doctor that works first time, then instead of blaming said individual, why don't you go and work that job for a day and see what they face and then figure out what's going wrong versus claiming you know what's going wrong.
Yes, amen to that. Well, this has been fantastic. I really appreciate the time. I'll put your LinkedIn profile in the description. Is there any other play? And I'll put Seattle Children's, of course, in the link there. If there's any other, please let me know if there's any other place. Like, I don't know if you're on Instagram. It's I do mountain bike videos there. That's about it. But if there's any other links you want us to follow, please let me know, and I'll include it in the description.
Yeah, thank you. Thanks for
absolutely
chatting with me today. It's been a pleasure.
It's my honor for sure. Thank you so much. I'm honored.
Thank you.
Take care.
Sir.
Have a great evening.
You too. Bye-bye.
Okay, bye.